Hi mga kudoks, kamusta na po kayo? So, it's my second day being alone at home because like what I've told you in my previous videos, my wife went home to the Philippines. She will be there for the next 21 days. So technically it's just 18 days left. So today I had my clinical attachment with pediatrics. So I've been having this clinical attachment for the past 3.5 months now. Technically, I'm not doing the attachment every day because I'm working. I have a full-time work. I'm having my clinical attachment usually once a week, but sometimes twice a week. So it would be one day in a weekday and one day in the weekend as well. In case if you don't know me, I'm a pediatrician from the Philippines. I worked there. I studied and trained there as a pediatrician. Then I worked in the Philippines for a year. Then after that, we went abroad with my wife. We worked in American Samoa. It's a US territory somewhere in the South Pacific. So we worked there for almost 2.5 years. I worked there as a pediatric consultant and my wife worked there as a nurse. So we were there from 2019 up to 2022. So after we finished our contract there, we decided to transfer here in the UK. That's why we need to work ourselves here from the bottom. So my wife finished all her exams. She was hired by a hospital here in the UK. Then I came right after her. After a few months, I already finished all my PLAB exams, which is one of the exams that you could take in order for you to be qualified to work here as a doctor in the UK. So I'm doing my attachment with pediatrics, and also I also did a month of neonatology clinical attachment. So technically I've been doing this for the past 3.5 months now. So today has been a very good day. All the doctors that I've worked with were really kind and helpful to teach me with things, to teach me with the system, with the computer. They also let me join the rounds. We saw the patients, we examined some patients. It's been, I've been having this for the past months, but today is a little bit happy, or a little bit better compared to the previous days, because the people were really good to me today, including the consultant. So one of the GP trainee today was really kind to me. She really taught me how to use the computer. I went with her during her rounds at the assessment unit. Even though she's busy, she's also struggling with her training. She really made time to help me. The consultant is really asking me if I'm okay, how am I doing, how am I in my registration process. So everyone was good today. So we've seen a lot of patients, mostly had respiratory tract infection. Some have gastroenteritis, so which are the common diseases that I also see in the Philippines. And there's also a lot of eating disorders here, which I haven't seen a lot in the Philippines. Although we see malnutrition, we don't often see eating disorders in the Philippines. So guys, I'm just gonna go inside because I'm already home. Another good thing that happened to me today was speaking to my consultant for today. So so like what I've told you, he was asking me how I'm doing, if I'm happy with my clinical attachment, and I told him I'm really grateful to have the attachment, and I'm really happy to have this opportunity. And I just told him before I left now that hopefully I could apply soon with the department and I could work. And he replied to me that he's really optimistic about me on having the job, and hopefully what he's saying would come true, and it's really true because I'm keen to be working as a doctor here in the UK as soon as possible. And fingers crossed that I could get my GMC registration as soon as possible. So I just passed all my documents to GMC just yesterday. So hopefully I could get a reply in the next few days. Then if I get the GMC registration and there's already a job opening here at my local trust where I'm having my clinical attachment, and hopefully I could get my first job as a doctor here in the UK. And it was really funny today because the GP trainee that I'm doing rounds with at the assessment unit was telling me that he's quite shy on doing the examination because we're doing the neurological exam on this one patient, and she was telling me that she's really shy on doing the exam because I'm already a consultant in the Philippines and those things. And I just told her that please don't feel that way because here in the UK I'm not a consultant, so most likely I will be doing a junior level job as well. It's really a fun day. It's a light day even though I'm tired because I have my regular work and I'm just doing my clinical attachment on my days off. But it was really a good day for learning, and it's really nice that I have this opportunity to see how the NHS or the UK health system goes with pediatrics. So that's my update for today. So it's my second day without my wife and I really miss her, but I need to go on with my day-to-day life here in the UK. So I'm gonna see you again on my next vlog, and please like and subscribe. Goodbye mga kudoks.